there, welcome back to Fem Health Talk with me, Kellen Mudhoni. And in today's episode, I want us to look at a very frequently asked question by women and girls that I am experiencing a rash, or I am seeing a pimple, or a very painful lump on my genitalia, and I have no idea what it is. Okay, so I want us to look at what are the differences between a rash, a pimple, a boil, an ingrown hair, a cyst, and a wart once you see them on your genitalia, and which ones are cause for alarm that you should visit the nearby health facility for them to be treated and given, and you're given let's say antibiotics and other kinds of treatment. So please stay with me to the end to find out more. So let's start by talking about a rash. A rash is a red inflamed patch. Okay, it's usually a patch widespread on your genitalia, and most patches are nothing to cause alarm because they are as a result of inflammation, let's say due to friction between your thighs when you're doing physical exercises, or is a result of friction between your genital skin because it is very sensitive and your clothing, or an allergic reaction, or basically just inflammation. So it presents like a rash on your genitalia. Okay, and that is why I said in the previous episode, please avoid using very harsh detergents or very harsh cleaning products to clean your genitalia because they will cause inflammation, and the inflammation will present itself as a rash. Okay, but if you notice that you have a consistent rash, a rash does not go away, and a rash that is very itchy, very painful, and some of those rashes even now begin to swell up. Okay, please visit the doctor, and they're going to diagnose and treat the rash accordingly, because some of the sexually transmitted diseases and infections present themselves as a rash. Okay, so diseases like genital herpes, gonorrhea, HPV, syphilis, and other STDs, they present themselves as genital rash. Okay, so if you notice that you have a rash that does not go away, and it is painful, it is very itchy, and it gets really, really swollen and tender and inflamed, and it does not go away, please visit a physician for further diagnosis. Okay. The second one I want us to talk about is a pimple. And a pimple on your genitalia is like just a pimple on the face, right? And a pimple is a small red bump with a white or yellow center. Okay, just like you get a pimple on your face, you can also get pimples on your genitalia. So it's a small red bump with a yellow or a white center that is sometimes filled with fat or sometimes pus. Okay, and most of the causes for pimples is a blocked oil duct, a blocked hair follicle, and most of them resolve on their own. Okay, so avoid popping pimples. Let them just ripen, and then they'll just disintegrate on their own. So if you find a pimple on your genitalia, please do not pop them. Okay. The other one is an ingrown hair, and we covered this in the previous episode. So an ingrown hair is basically hair curling inwards instead of growing outwards. Like I covered in the previous episode, if you shave wrong or you groom your hairs in a wrong way, okay, in the wrong direction, so that hair will be trapped. Instead of growing out, it starts growing in, and then it pushes the skin of the genitalia outside, and it will cause those bumps with an ingrown hair. Okay, and how to resolve them is exfoliate. There are these exfoliants that you just scrub that ingrown hair, and it just comes out of its own. Or you can pick tweezer, okay, and then pick the ingrown hair. Sometimes they even called, inajical kabisa. So just pull the ingrown hair and ensure that in the future you use the correct technique of shaving and the correct technique of waxing. All right. So next we have a boil. A boil is a red swollen lump, and it is very painful, and most of the time it is filled with pus. Okay. So it is red, swollen, painful, and sometimes filled with pus, and it is as a result of bacterial infection. The bacteria is called Staphylococcus aureus, and it infects the hair follicle or the oil duct. Okay, so it presents itself as a red, painful bump filled with pus. Okay, do not pop the boil. All right, and sometimes they even appear on very, very strange areas. You can find that boil on your labias. Sometimes that boil even comes in between the labias, or sometimes they even come at the butt crack, and they are very, very painful, especially when you want to sit or walk or do any other tasks. The boils are very painful, so please do not pop the boil. Okay, if it will disintegrate and just um uh, 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 how do I say it? It either a pop on its own, and it produces as a pus, and the pus usually smells very funny. Okay, so don't pop boils. I just go to the health facility if at all it is so painful to work, and the health physician will pop the boil for you, and also will give you those meds to deal with the bacterial infection. So next we have a cyst. A cyst is a red, swollen sac, sometimes filled with air, sometimes filled with pus. Okay, and the difference between a cyst and a boil is that a cyst is usually most of the time painless. Okay, so unlike the boil, a cyst is a painless most of the time, painless swollen lump or bump filled with pus or filled with air, or maybe let's say some fatty cells. Okay, and they are usually as a result of a blocked gland or a blocked duct. Let me say that one more time. They are as a result of a blocked duct or a blocked gland. And there are two main or two common types of cysts that you will find on your genitalia. The first one is a sebaceous cyst, and the other one is a Bartholin cyst. A sebaceous cyst is as a result of a blocked sebaceous gland. Okay, so we all have sebaceous glands, and the gland is to produce sebum. Sebum is that oily substance that keeps your hair follicles moisturized and oily. So if that duct is blocked, or if that gland is blocked, okay, it will form a lump that is swollen and filled with that sebum or oily or pus, and it is most of the time painless. If the cyst gets infected, now it becomes painful. Okay, the other one is called a Bartholin cyst. Women, we have Bartholin glands, and they are located at the openings of the vagina. So if at all this is the vaginal opening, you have two Bartholin glands. So it is located at each side of the opening of the vagina. And the function of the Bartholin gland is to produce fluids to lubricate the vagina. Okay, so if this Bartholin gland is blocked, or the ducts to the Bartholin gland are blocked, it will result to what we call a Bartholin cyst. And the Bartholin cyst will be a swelling at the opening of the vagina. So it will be red, swollen, and filled with pus. And most of the time it is painless. But if it gets infected, it becomes painful. Okay, so do not pop those cysts. Do not pop the sebaceous cyst or the Bartholin cyst or any other kind of cyst. Okay, because once you pop them, it opens up and allows room for bacterial infection. So let it just dry on its own. Let it just pop on its own and dry, but do not force them to pop or open. I know they get so uncomfortable, especially during walking or sitting or basically your day-to-day activities. But once you experience them, do not pop them. Okay, last but not least, let us look at genital warts. So genital warts are soft lumps or growths that resemble a cauliflower that grows around the genitalia, around the anus, around the rectum. Okay, unlike these other ones, these ones have a very distinct appearance. They are as a result of a sexually transmitted infection. So once you see these genital warts, please go to the hospital, see a physician as soon as possible. Okay, so just to recap, we have looked at 6 6 things. Okay, we have seen what a rash is. A rash is more patchy, it is usually spread on the skin. We have looked at what a pimple is. Okay, like the way you'll grow a pimple on your face or on your hand, you can also grow a pimple on your genitalia. Okay, we have looked at ingrown hairs. So wrong shaving, wrong waxing will cause ingrown hairs, and that they will form a lump that has a hair follicle trapped in the skin. Okay, we have also looked at boils. Okay, boils are painful, lumps, reddish, and they are filled with pus. Okay, so one characteristic of a boil is that it is as a result of a bacterial infection, and it is painful. So we have looked at a cyst. Cysts are blocked glands or blocked ducts. Okay, and they present themselves like boils, but most of the cysts are painless and less infected. And we have said that the cysts can present in two major types of cysts. So sebaceous cysts, blocked sebaceous glands, or Bartholin cysts, that is blocked Bartholin glands. And finally, we have looked at genital warts and how they present themselves fleshy, looking like cauliflower, and they are a presentation of a sexually transmitted disease. So you are so empowered. Thank you so much for watching to the end. I will see you in the next episode. Bye.